The views and opinions expressed in this interview are those of the interviewees and do not necessarily reflect the views or positions of HeavieTalk Media and TheBlack.Blog. HeavieTalk Media and TheBlack.Blog do not endorse any products, services, or businesses advertised and is not liable for any products or services purchased.
My name is Dr. Tasha Bruner-Hill. I am a family nurse practitioner. I opened up my private practice back in September of 2023. I decided to go into private practice after practicing in what's called a federally qualified healthcare facility. And basically, most of our population was Medicaid or underserved or non-insured populations. And I really have a passion for helping that population. The problem that I experienced was the 15-minute rushed appointments. We saw about 15 if we were lucky, but on a regular basis, 20 to maybe upwards to 26 patients a day. And I wanted to focus more on the patient and provide that overall holistic care. And for me, when I say holistic, I mean looking at the whole entire person, looking at the social determinants of health, meaning that if I'm treating a particular diagnosis, that I need to think about, can they afford this medication I may be giving them? Is there a grocery store in their neighborhood if I'm telling them to eat healthy? Is housing a concern for them? Because that supersedes everything. If I don't have a place to live, no matter what you tell me on how to take care of myself, my focus is on housing. So holistic to me is taking in that whole person. It's also holistic as you normally hear as far as eating healthy, not having a lot of processed foods, exercising and everything, but all that involves the whole entire person. Well, one of the reasons, again, I went into healthcare is because some of the challenges that I faced as a Black woman, as a Black parent, simply not being listened to.
Right.
And if you listen to a person, you can find out a lot about them. But also, what are those factors, as I stated, that's impacting their health? That's one of my major challenges is I'm having people who come to me because they weren't listened to by their providers. And to me, that's a disservice. And you can't impact the health of a community if you're not listening to what the community has to say.
This was a preview of the interview. Watch the full interview for free on HeavieTalk Media's Patreon. See you there.